Hello, this is Andrew Appel. I am joined today by two of my compliance guru colleagues from our Employee Benefits Division, Stacy Small and Kylie Fields. Welcome.
Thank you.
Thank you.
Before our listeners turn it off at thinking compliance is going to put you to sleep, I'm here to tell you compliance is cool. So with that, let's dive into it a little bit. So Kylie, if you want to start out, I know I referenced both of you as compliance gurus, but you kind of take the lead in assembling our weekly compliance update. Could you maybe give our listeners kind of an idea about the pace of change in the compliance world?
Yeah, so not to sound like an ad, but it is fast-paced, moving, and we are kind of at our peak right now. So things are constantly changing in the compliance world. A lot of legislation turnaround as well. So it's been new and exciting. Some updates on previous things, such as mental health parity, but then also some new forefront as far as transparency and coverage, gag attestation, and a lot of more that we'll cover later.
Kind of as a little bit of a level set for listeners. We're recording this in early December of 2023. Things almost certainly will have changed by the time you listen to this. And obviously at this point of the year, especially for people who have benefit plans that are starting 1/1, language, all that stuff is pretty much baked in. But just to kind of give a sense of how quickly things can evolve, what would you anticipate in Q1 of 2024 that people should already start to be thinking about?
Well, yeah, and even in December of this year, I'll say. So, I mean, we have new reporting that wasn't even in existence as of a year ago. So, there's something called RX reporting that's coming Q2. There's also, for the first time ever, the gag attestation clause that's due December 31st of this year. And then kind of getting plans ready for those next implementation phases. So there will be an analysis requirement for mental health parity. But as of 1/1/24, there will be no opt-out. So this will apply to everybody. And I think that's really the important piece to all of this is just knowing, being aware of these new regulations and making sure that you are actively trying to comply with them, because the DOL, I will say, has been really good with understanding that it's a good faith effort that all of us are trying to do this, especially as new regulations come down. But at the same time, you definitely don't want to get caught as the sitting duck, I call it. That's when you'll meet those unfriendly monetary fines, and the auditors are none too kind.
I didn't know there was such a thing as a friendly monetary fine. Stacy, let's turn to you for a minute. So can you help me as a business owner and leader who knows enough to be dangerous about employee benefits and wellness? Could you help me understand in kind of layperson term what mental health parity is going to mean?
Yeah, sure. So, mental health parity, I think we've really just started to talk about it over the last couple of years, but in reality, it's been around since the mid 1990s, like 1996. We've just continued to expand upon it. And basically, what it aims to do is make sure that mental health, substance use benefits are treated the same as any other. So medical, surgical. So think about it as an employer. You have a health plan. You cover people being in the hospital, having surgery, things like that. What mental health parity aims to do is literally treat mental health the same. That is, not applying anything more restrictive on the access to mental health. I'll take us back even a couple of years. We get a global pandemic that, for many people who never experienced things like anxiety, maybe depression, so much uncertainty about our own health of our families, etc. Mental health really came back up into the forefront. And, when we talk about substance use, obviously, unfortunately, morbid thing to think about, but in our industry, transplant policies are becoming more expensive because of the number of deaths of young people due to substance use. So at the end of the day, this is just another way to battle making mental health more accessible and available to people on a daily basis. So as an employer, what you're really doing is trying to make sure your health plan treats those mental health benefits as good or even better.
And I will,
as med surgical.
I'll jump in here to say, if you're listening and you're wondering, okay, well, where would I find these kinds of limitations that I should be worried about in my plan that I'm offering to my participants? These are things historically that we've known as prior authorizations, mileage limitations, fail first policies. It's in that respect that we're seeing, and I will say I've done many cursory analysis, and you never see an employer who's outright discriminatory, right? That's never been the root issue. Where we see these discriminatory actions, if you will, is where you don't let somebody go to that rehab facility. But what the government's trying to do is bring you back and understand that when you go somewhere far away for that, it's a different connotation than if you were to go for instance, you're not going to go far away to get your gallbladder removed. You're going to stay close to home. You're only going to stay long enough for that surgery, and then you're going to go home and rest. But think about substance use disorder. You tend to go further away. So we do tend to see that where, the government's trying to say we need to not only meet these people halfway, but we need to make sure that they're getting the treatment that they need for the amount of time it takes for them to recover. And that's going to look very different than medical and surgical.
Yeah, and I'd say, having been in this business for, I'm going to say, well, we'll call it north of 20 years. I look back to the days where we didn't have conversations about mental health and mental health benefits. In fact, it was the opposite. There was really a negative connotation when you talked about mental health. It was just sort of a benefit that was in there, but nobody talked about it. We're bringing that to the forefront now, and really making sure people understand and know that it is okay to seek treatment. You should seek treatment, and you shouldn't have to face barriers in front of you in order to do that.
From an employer standpoint, what are my communication requirements? So start with requirements for my colleagues, but what would you say would be best practices for something like a mental health parity requirement that is truly broadening availability of coverage?
I mean, the first thing you have to do is be transparent and very, very upfront with what you're willing to cover. Bottom line, if I'm seeking coverage, I need to know what you're going to cover and what you're not. But then also from there, I think where it can get a little sticky is the language of we'll see things like investigative, experimental. You really need to be more of, here is what we're willing to cover. And with mental health, and I will just make sure everybody knows this, mental health isn't saying you have to cover this or that. What it's saying is if you should cover the disorder, the diagnosis, you are then required federally to cover the treatment and the RX that coincides with that. So I think first and foremost, before you even put out communication, you need to come together as an organization and decide, okay, what am I willing to give those who are on my plan? Do I want a robust plan? Do I want to cover everything and make sure that they know that? Or am I going to be a little bit more selective, maybe due to the economy or financially, because we have to be more restrictive? But figure out what you're willing to do and then just simply convey that in the clearest way possible.
And I do think it's a good opportunity to take a reset on your overall mental health benefits. As an employer, most of us offer employee assistance programs, and that is giving people access to some mental health care free of charge. It is confidential. But I think at the end of the day, as Kylie said, really communicating out to your folks that mental health is important and seeking treatment for those mental health conditions. I would say as an employer, not being, again, I use that word barrier, but to people receiving that very important care. I will add too that the law doesn't require you to communicate in any specific way. There's not a notice that's required to give to employees. I think it more goes to the common sense of, being a business owner and wanting to, let your employees know what's available to them. It's all part of, we talk a lot here at Gregory Appel about being a team, and it's really, I think, stressing what's available, what we offer, and it's more than just Mental Health Parity Act. It's the wellness programs, it's the EAPs, it's the communication to our staffs of what we're doing to help promote their mental health.
Let's just use an example. XYZ manufacturing company, about 200 employees. They've probably got an HR department that's, I'm just going to stereotypically say, has like one HR professional and maybe a payroll person wearing a lot of hats, trying to do the best they can. How would you recommend that that person stay up to date with compliance, right? You do this day in, day out, and you would even admit that sometimes it's hard to keep up with the pace of change. How would you recommend, that HR professional try to stay up to date? Because I'm sure the last thing in the world they want is to be out of compliance.
Yeah,
That's a great
so-
question, and one that I'm sure many of the HR professionals out there can empathize with, because they are constantly wearing all these different hats, and compliance, while it's my entire world, is not everybody else's, and I respect that. I would definitely subscribe to a newsletter. I mean, the DOL has one, HHS, CMS, Gregory Appel has one as well. Making sure that you have somebody who is selecting the most pertinent information to send out. In that way, you can have it all distilled down in layman's terms, where you can just read it over a cup of coffee in the morning, figure out, okay, bottom line, what do I need to do? That way you can implement at the very minimum threshold the requirements that won't get you into trouble, or reaching out to whomever is administering your plan. A lot of carriers have really great resources out there, and more account managers are having the ability to pull from some of these really great tech companies. But again, just making sure that there is a person behind those is my only word of caution, because unfortunately, if it's just robot pulling different things, it doesn't really get into all of the ongoing compliance issues that are still being debated.
Right. And I think that's also coming from a little bit of the other side of benefits. While, I do label myself a compliance, I'll call it geek as well, being in the actual consulting with many of our clients, it's having that collaboration. So we do a great job here, I think, of, again, putting together a weekly communication that goes out to clients that actually, really lays out the most timely topics for them. But then we put it into play as well when we're meeting with them.
And we will put the link to the weekly compliance update that Kylie was referencing in the show notes. So check it out there if you want to subscribe. Stacy, I want to come back to you and continue in the kind of the consultant hat versus the compliance geek hat, which is a lovely hat for people who are listening in audio format. It's smashing.
I swear it's not pointy.
Yeah. Have you seen any best practices on the client side that you think have been especially beneficial to get in that muscle of constantly staying up to date on compliance and getting ahead of things versus reacting?
Yeah, I think it's difficult because, and I'm going to take us back even a little further, but 2010, when the Affordable Care Act came out, I feel like since then, we've been in a constant evolution of employee benefits, new compliance issues, et cetera. So, I do think that getting that trusted compliance source and really utilizing it, you've got to read. We are in an electronic world right now. The number of emails that come in daily, weekly with, from your carriers, from all of your vendors, from your trusted advisors like us. It's really having the dedicated time to look at that. Don't try to go it alone. Folks that say, oh, I'm not sure that applies to us, and they just simply push it aside. I think that's an example of how not to do it. Ask the questions, reach out to those trusted advisors and say, how does this play for us? Can you help us? We have a lot of resources to do that. I'd say the ones that are most engaged with those advisors are probably doing the best job of protecting their employers from those pesky fines that Kylie was talking about.
So I'm hearing both of you in some way, shape, or form encourage people to make it a part of a weekly routine.
More is better in this regard. I've sat through many audits, and I will tell you, saying, the catchphrase of, oh, I didn't know that applied to me, or, oh, what is that, is never the good route to go. If anything, I joke about the DOL auditors, but they're kind of like that house guest on the holidays that you don't want coming over because they never leave. That's kind of how they are with audits currently, because once they get in that door, it becomes, oh, well, let's look at ERISA. Oh, let's look at COBRA. And next thing you know, they're there 1, 2, up to 4 years. So understanding that, you're not going to know everything, and that's completely fine, but doing something is always better, because I'll tell you right now, with mental health parity, for instance, there is no plan that has passed the threshold, not a single one, because we don't
the threshold is still being determined.
Still, yes.
Where case law is determining at this point.
Yes, and updates are coming. I mean, we just got one in July. So, I mean, still ongoing talk in Capitol Hill. So ongoing, but at the same time, again, that reasonable due diligence, that good faith effort, that's what they're looking for. So having another bow in your quiver is always better for your defense than if you just are caught, without anything. So that's definitely something I would add on to that for clients.
Yeah, definitely.
Ask the questions, attempt it, always attempt it.
Yeah, how is it? Kylie has a JD, and I think that the phrase possession is 3 quarters, or however that works out. Think of compliance that way too. If it's on my plate and I'm responsible for it, should we have an audit and come up short, if I'm the one holding the bag, it behooves me to be involved, to ask the questions, to spend the time, devote the resources. It's important. It's the law. And again, there are the fines.
So I'm hearing, when we talk about compliance, that can come from kind of 3 directions: legislation, rules predominantly set by the Department of Labor, and then the courts. Is that fair?
Yeah, absolutely.
Yeah.
But sometimes you'll sprinkle in CMS and HHS. They
Oh,
have
yeah,
their
yeah.
own. Yeah. So, I mean, and which shows you how complex this really is. I mean, there's different viewpoints coming from every, faucet that you can imagine, and keeping up with them can be tiresome. But at the end of the day, I think the one sticking point that all of the different, opinions out there are in agreement on is the fact that you are liable. It is an employer mandate, and not knowing is not an excuse. So, and again, if you don't know, reach out to somebody, anybody. It's just start asking those questions, because I guarantee you every breadcrumb you can leave in that paper trail is going to help you in the long run.
And Kylie, you had referenced sitting through a number of audits. Dear listeners, Kylie's not an auditor. She's not coming after you. But
insert disclaimer at the bottom.
Yeah, insert disclaimer. Could you maybe, in your experience, how do you see audits getting triggered?
That's a great question. It used to be whistleblowers, but unfortunately more and more auditors are being hired, and we're seeing something called an MHPAEA audit specifically. So that is when the government looks and says, you know what, I wonder if, like you said earlier, X, Y, and Z manufacturing has an MHPAEA analysis completed. Let's reach out to them. And they're hoping that you don't, because once they get that foot in the door, well, then it can turn into a full-blown audit. So it's more and more random. And I always joke that auditors are like, if anyone has a toddler going to, not to say that the competence level, so auditors out there, please don't come for me, but simply saying, when people say, how is this audit going to go? It's like trying to guess what the toddler's behavior will be if you take them out to a restaurant. I have had auditors that come with a checklist. They're in and out the door. The client has completed, to the best of their ability, analysis. They're in, they're out. Other times it is a fiasco. It is, well, I'm here for MHPAEA, but let's also pull, things, your Form 5500 from 2 years ago. So it can go any way, but at the end of the day, I think it's really important that if you have something to show it, but that being said, do not give them the kitchen sink. If they're asking for something, give them that. Wait for them to ask for the next thing. The whole gambit is that we're going to ask for a lot of things in a short amount of time, hoping that you will give us too much. Whatever you give up them, they can go through with a fine-tooth comb, because they have much longer of a time to go through that.
Yeah, they don't have a time frame.
Essentially, only you. So
you have a time frame.
It's a really fun game show.
Only answer the question that was asked, spoken like a true JD. Thank you.
Uh-huh.
I'm going to ask you to put on your speculating hat. So, full disclaimer, knowing that 2024 is going to be an election year, so the likelihood that major legislation is going to move is low. But are either of you hearing any rumblings out there about kind of a broad category of legislation that might have an impact in next year's plan design?
I think we would be remiss not to talk about GLP-1s. I mean, this is huge.
Yeah.
This is it's blowing up daily. I guarantee it. Most of our listeners know somebody who is on Ozempic or Mounjaro or one of those drugs. And then recently, I know with Lilly, so Mounjaro is now Zepbound. It takes away the type 2 diabetes requirement. So there's no longer that prior auth. So I think employers really need to be thinking about how they're going to address this, because if there's no longer that prior auth, that means more access to more people. But unfortunately, with employer health plans, that's more liability, more risk, and of course, more money. So I think that's going to be debated heavily next year.
It will. And I think for health plans, it's something we're really already talking about. But as more of these medications, in fact, I just saw something this morning where one of the major pharmaceutical players has purchased another organization solely because they have multiple of these GLP-1 or obesity treatment type drugs out there, and it's where the money's at right now in the pharmaceutical industry. So we are seeing more and more players enter the space, and we are seeing, as Kylie mentioned, the FDA begin to approve these medications without a diagnosis other than weight loss. So for health plans, it's a big thing to think about, right? Because we've also seen anyone on social media, young people that may not necessarily need to lose weight utilizing these medications, right? So as an employer, it's weighing that benefit between helping, we're Midwestern, we're in the Midwest. So, there is probably some value in it, but we also don't have long-term, stats on these medications and what they could be creating, down the line. But definitely from an employer perspective, covering or not covering, especially with our self-funded clients, that's a choice they will make. But these are going to continue to be an issue.
And you both kind of talked around it a little bit, but just to, I guess, ask a clarifying question. The major concern is around cost, correct? It's not to some degree, Stacy, you
Right.
commented, there is some question on efficacy in non-diabetes
Right.
usage. However, the primary concern from an employer standpoint is the cost, correct?
It's cost, and I would throw it back to medical necessity, right? So typically when we're looking at our health plans, they're designed to cover medical conditions, right? That there is medical necessity to, have a surgery, prescribe a medication. So this is something a little bit new in that, yes, obesity is a medical condition, but whether or not you can prove a medical necessity. So almost all of our health plans, that's the determining factor. Is there medical necessity to prescribe this course of treatment? So cost is certainly big, but I would also say whether or not it's being appropriately used. And so you can connect the dot there, and it's happened in the past, and that is, if I'm a health plan and I'm covering this medication with, essentially, I don't have to have a diagnosis of type 2 diabetes, et cetera, am I somewhat liable for people that are accessing this that may not, need it, or it could do damage?
Yeah, and I think it's important to point out that these are all new drugs. So we really don't know the long-term repercussions yet as far as, getting off them, what it's going to do to the body. I mean, I know that there's been talk, there's been fear, things like gastroparesis starting to occur. So, I mean, again, still, and again, another disclaimer. I do not have a medical
word. Yeah, that was a really big word.
I do not have a medical hat. I'm not a physician in any way, but still, I think there is kind of a ethical side, and also I hate to say maternalistic or paternalistic, but I mean, I know a lot of employers who really care for their employees and want to make sure that if they're providing something for them, it's a benefit at the end of the day, not something that's going to long-term be more harmful.
Mhm. So rapidly evolving.
Always, always, always.
As we wrap up the conversation here, again, the Compliance Weekly newsletter information will be in the show notes. But I guess closing thoughts, Stacy. Let's start with you.
Yeah, so I mean, I think definitely having, keeping compliance in the forefront of the mind as the employer is super important. If you aren't getting our newsletter and you would like to, reach out. We'll get you added to that list. But again, we pick content every week that we hope is timely. We will continue to do that and have a focus on compliance for our clients and see what 2024 brings. Andrew, as you mentioned, we will have an election year. So while we wouldn't expect probably anything big to happen this year during 2024, post-election, depending what happens, we all know that can set things literally on its head, and you get a whole nother set of things to accomplish. So yeah, with that, I would say everyone should have a little bit of a compliance geek hat, especially as a business owner, especially those HR professionals.
Kylie, how about you?
I think something to just keep note of is the fact that there are so many regulations. But that being said, and I'm sure many of you think this, it can be almost to the point where you think, well, the government's out to get us, right? They're coming up with new stuff. It makes no sense. It feels like this tangled web. But at the end of the day, I just want to make sure that, we really talk about the why. And I think that's something that unfortunately never gets into compliance conversations. All these regulations really stem from the fact, specifically transparency and coverage. That's something that's ongoing. Everyone's heard there's the RX reporting, the GAG attestation. There's been several that have come out from this. But the real root of this is because the government cares. They tried to implement regulations at first, realized, okay, how are we going to regulate something that we know nothing about? There has been no transparency historically with RX, with these big carriers specifically giving this, we hear the aggregated data. Really, that means scrambled eggs, guys. That means we are putting all of our clients into one big pot and you can guess what we're going to do with it. So the government really identified this issue, and this is now the regulations coming out to identify what's going on. That way they can fix it. So you see the issue, then you fix the issue. So it really is positive. And like to Stacy's point earlier, mental health parity, that was a result of COVID. We saw the exhaustion, the burnout. Society was really, going through a hard time. And this again is the result of the government saying, not only do we need to get help, but we need to make sure that we have the resources available, the amount of resources available to help society as a whole. So just remembering that at the end of the day that, this isn't just to burden HR professionals because, obviously you guys are doing so much, but it's also as a way to long-term, big picture, help us as a whole.
Thank you. And also thank you for the Sunday crossword puzzle words that you dropped throughout this conversation. Stacy, Kylie, thank you so much for joining, and I hope everybody found this conversation helpful.
Thank you, Andrew.
Thank you.